In this video, we're going to perform a readout of the page called Syringoma and Electrofulguration, which is basically talking about how we use electrical arcing in order to remove syringoma. So if you watched our videos and you've studied this website, you realize that this is one of the most effective ways to remove syringoma in aesthetic clinics. And you can actually watch the videos on this webpage where we actually describe and we show you how electrical arcing is used in order to remove syringoma. But let's actually do the readout here. So what is electrofulguration? Electrofulguration or electrodesiccations are all synonyms of a similar method used in cosmetic procedures. Electrofulguration or electrolysis, which are slightly different, but we're just going to call them the same for in this instance, is normally used for epilation, red veins removal, and other applications. Electrofulguration is generally used in cosmetic procedures because the high degree of accuracy in the ablation of the benign skin lesions. The higher degree of precision and low power levels, less than 2 watts, makes the cosmetic procedure extremely effective and safe. And this particular image, we're actually seeing the difference between electrofulguration, which is actually an arc that goes into the skin, and electrodesiccation, which is actually the same type of physical phenomenon, but with a different configuration, and the ablation is much deeper. But we're not going to talk about that in much detail here. Electrofulguration normally occurs without the return pad. The spark or arc will occur between the tip of the electrode and the skin. As seen in the picture above, the advantage of electrofulguration is that the ablation is much more precise and superficial than electrodesiccation by using the return pads for the same reasons. Electrofulguration is the preferred option for cosmetic and aesthetics treatments. As shown in the above video, electrofulguration is very effective in burning off syringoma. One of the main advantages of electrofulguration is that all or most of the syringoma can be removed within one session. The cosmetic results are usually excellent, and the beautician has taken care in leveling the syringoma off. Now, as we've seen in other videos in other parts of this website, basically, in order to minimize the risk of recurrence or the recurrence rate of syringoma, it's best that you actually go a bit deeper than just leveling off the syringoma with the surrounding skin, which is, we actually written this in 2015 when we didn't have as much experience on removing syringoma as yet. But now, with the experience we've got, we know that it's much better to actually get deeper inside the skin, because syringoma is actually rooted a bit inside the dermis. So you've got to go inside the skin a bit more than leveling off. If you're leveling off the syringoma, as many other cosmetic clinics do, basically syringoma will be back on within 10 days after the treatment. So we'll be back to where they were, almost back to where they were before you treated them. So, and the customer will not be particularly pleased. The success rate of these procedures is very much dependent on the ability of the operator and the equipment used. The equipment has to have the capabilities to operate at very low power, because the syringoma are not very thick, and a powerful ablation could result in damage to the dermis and therefore permanent scarring. When we wrote this particular piece of information, there were many devices out there for this application, but now there is more and more. So the problem by having the high power device and so on is not there anymore. At the time when we wrote this, the main device that was used for this was the hyfricator, whereas now there's many other devices on the market, so it's not a big deal. The method used to remove the syringoma by electrodesiccation is very simple, and this involves simply ablating the lesions from the top and level it off with the rest of the surrounding skin. However, since syringoma reside inside the dermis as well, in order to minimize the recurrence, it is advisable to ablate them deeper inside the dermis, and which is actually true. We actually knew even then. This is because It has been reported that most of the recurrence of syringoma is due to the fact that simply leveling off the syringoma with the surrounding skin is not sufficient to remove them completely, and they will regrow soon after healing, a couple of weeks after the cosmetic procedure, and this is actually true. So also we've got this particular video which we actually shot in 2015, which appear there. I mean, people tend to say that I'm better looking now than almost 40 when I was 35, but anyway, that doesn't really matter. Thank you very much for watching this video. And you find much more information on syringoremoval.com, and if you don't find the information you're looking for, why don't you just get in touch with us? Our contact page is on our website. So thank you very much for watching. In this video, we're going to do a readout of the page called What is Dermabrasion for syringoma removal. So what is dermabrasion? Dermabrasion is an exfoliating technique that uses a rotating instrument to remove the outer layer of the skin, and this can actually be used to basically is another method to destroy the skin, and is a mechanical method, and this is another method that you can actually that are used in cosmetic clinics in order to remove syringoma, because what you're doing is ablating. So in this case, the ablation is mechanical, usually on the face. This treatment is popular with people who wish to improve the appearance of their skin. It's actually used for mechanical exfoliation, basically. Some of the conditions it can treat include fine lines, sun damage, acne scar, and uneven texture. Basically what this method does, again, you've got a device that ablates the skin in a mechanical way. Some of these devices are like sanders, basically, and they've got ablative effects, mechanical ablative effects. Dermabrasion occurs in a dermatologist's office, not necessarily in the UK. They've been used for several years by beauty therapists. During the procedure, a professional will numb your skin with anesthesia, therefore removing before removing the outermost layer of your skin. This is an outpatient procedure, meaning you can go home soon after the treatment. This is actually, it's got a medical connotation, which it doesn't really. There are several over-the-counter devices that stimulate the cleansing and exfoliating process of professional treatments. This typically takes longer to produce the desired skin smoothing effects of professional dermabrasion, and usually don't achieve the full effects. I'm not sure about that. What are the reasons of getting dermabrasions? Dermabrasion removes the damaged layer of the skin, and you can actually use the same technique in order to remove syringoma in cosmetic clinics, but it's not a very popular method anyway. Exposes new skin layers of the skin that appear, and therefore the skin appears younger and smoother. So it's used for acne scars, age spots, reducing fine line, the appearance of fine lines and wrinkles, precancerous patches. Is not used for that as much actually. Scars from surgery. I'm not able to read this. Sun damage, tattoos even, but not very popular at all, and even skin tone. Dermabrasion is only one of the many treatments for these conditions. For instance, advantages in laser technology make laser tattoo removal quicker and easier. Talk to the dermatologist about the treatment options for your specific conditions. I don't know why we're talking about tattoo removal here. Some skin condition may prevent your doctor for performing dermabrasion, including inflammatory acne and so on. I would actually leave this particular part. How do I prepare for dermabrasion? What happens during dermabrasion? And so like, what happens after dermabrasion, aftercare, and so on. I'm just refraining from reading the whole lot because it doesn't actually talk about how it is used for syringoma removal, but actually if you want to read about dermabrasion, you've got this on this webpage. But I'll stop here and you can access this webpage. But basically, the points I would like to make in this video is that dermabrasion technically can be used and has been used for syringoma removal. However, it's not the most popular way to remove syringoma in cosmetic clinics. The most popular ways is laser, electrical arcing mainly, and electrical arcing is becoming one of the most popular ways to remove them. Some people are even buying these devices to do it at home on their own. So if you want to know more about syringoma removal, just go on syringomaremoval.com, and if you don't find the answer to your question, please get in touch. Thank you very much for watching this video. In this video, we're going to do a readout of a page called Using Pills in Clinics. We've talked about TCA. This TCA, trichloroacetic acid, is the one peeling that's been used for several years in clinics in order to remove syringoma, because TCA is extremely effective and it has been used also at home more recently. So, and this is the main topic of this webpage. So remember, if you have syringoma, one of the ways to remove your syringoma is by using TCA, which you can actually buy inexpensively online. It's hard. TCA peels in clinics. When it comes to specialized peels, the preferred option for syringoma removal in cosmetic clinics is TCA. The main reason is that TCA allows easy removal of syringoma, usually within 1 or 2 sittings or sessions. This makes this product very successful within cosmetic clinics because the client can see the results soon after the first session, and the results are achieved within relatively a short time frame. However, TCA is not very easy to control, and compared to other types of cosmetically peels, it could be too aggressive on certain skin types and more prone to cause hypo or hyperpigmentation. Mainly what we're worried about is hypopigmentation because it's permanent. Hypopigmentation can be permanent, so there's nothing you can do about that. On the other hand, hyperpigmentation can be resolved. Other than other types of peels. Therefore, it may not be the best option for home use, given that there are milder peels available on the market which are easier to control, namely glycolic acid. TCA is a non-toxic chemical trichloroacetic acid which has been used to perform skin peels for over 20 years. It is a relative of vinegar, acetic acid. When TCA is applied to the skin, it causes the top layer of the cells to dry up and peel off over a period of several days to 1 week. When the old skin is peeled off, it exposes a new layer of undamaged skin, which has a smoother texture and more even color. Some dermatologists, in fact, will prefer TCA peels for treating sun damage or melasma, usually in combination with prescription creams. TCA peels are safe in the hands of an experienced dermatologist. TCA peels may be a good option, particularly if you have syringomas. Usually, the main choice for syringoma removal in cosmetic clinics is the use of TCA peels if they want to use this option, because we find that, especially nowadays, more and more people are using electrical arcing. This is because it is, if used properly and at the right concentration, TCA allows removal of the syringomas in 1 or 2 sessions only. This is ideal to both cosmetic clinics as well as the customers, because this allows achieving the best possible results within 1 session. However, if concentration is too high or the application of the TCA is not done appropriately, the cosmetic procedure could result in mild scarring, a very rare occurrence. Actually, there hasn't been one that's been reported to us so far. On the other hand, If the concentration of TCA is too low, results will not be apparent and the client will not be satisfied. So, by using the right concentration of TCA, it is possible to remove the syringomas in 1 or 2 sessions. TCA is the best choice in cosmetic clinics because the results are achieved and appreciable in a short time frame and few sessions. This makes both the client wanting to remove their syringoma and the beauty therapist usually very satisfied. The client is happy because their problem is resolved, and the beauty therapist has justification to invoice the happy customer. TCA drawbacks control. However, the use of TCA requires a certain experience in order to achieve good results. This is because TCA is very effective but not as easy to control, and for this reason, neutralizers sometimes need to be used during the cosmetic procedure. The main reason for the sort of control difficulty of TCA is that it is not as easy to neutralize by using water as alternative glycolic or mandelic acid. These are some of the effects of TCA for syringoma removal. Excessive eyelid swelling. This occurs 1 or 2 days after the application of TCA on the upper or lower eyelids. Stinging, numbness, and burning of the skin. Skin peeling, including excessive peeling if you have a medium depth peel. Redness, which can range from the color of a mild sunburn to a deeper red, depending on the peel. Crusting or scabbing of the skin due to the skin cells being removed, which is normal. Increased photosensitivity, sensitivity to the sun that can lead to hyperpigmentation. In some cases, when someone has sensitive skin, scarring, dermatosis, pigment problems can also potentially occur. Additionally, as stated above, TCA is not very easily controllable, and the most effective way to stop its acidity is to use a neutralizer. Please note that rinsing with water and drying the area can help but will not stop the effects of TCA immediately. How do TCA peels work, and what are the different depths of peels? Now, in this picture, we actually see how TCA is applied on the syringoma. Basically, it's applied actually on top of the syringoma, and this is the effect immediately after the application of syringoma. You see it becomes white, and this white is typical of syringoma, or of TCA. It's very, very typical. This gentleman is Hispanic. All peels work by removing a layer of sun-damaged skin. Superficial or light peels remove only the top layer, mostly the layer of dead skin called the stratum corneum. Progressing from medium to deep peels, the layer of skin removed is greater with each increase of strength in the TCA peel solution. The stronger the TCA peel solution, the greater the risk of complications like uneven pigmentation or even scarring after syringoma removal. TCA peels can be performed at different skin depths from shallow to deep. Most dermatologists now are using laser technology instead of deep TCA peels for syringoma removal, and now more and more beauty therapists are using electrical arcing. Lighter TCA peels are usually done in a series of 2 to 3 for best results. This is similar to other light peels that usually involve hydroxy acids such as glycolic, salicylic, or a mixture of other hydroxy acids. Medium depth TCA peels are usually done once or twice a year and do require some downtime, usually about a week when the peeling is obvious. And then you can actually watch this video on our website here, but basically this white is typical of TCA. So in this video, they actually do not talk about what they're using, but this is TCA. Watch the effects of TCA for syringoma removal being used in a reputable cosmetic clinic. As you can see, the effects are similar to some of the products you can buy online. Although it is not mentioned in this video, we believe the active ingredient used to be TCA or BCA due to the whitening of the area where the product has been applied. Also, mild swelling and as well as dark scabs suggest the use of this type of peel. Click here to watch their very good results in their clinic website. Watch this other video below, specialized peels used in cosmetic clinic, and this TCA, another video where TCA was probably used. So this is all for this video. Once again, if you've got syringoma, TCA, trichloroacetic acetic acid, may be the solution that you choose. It's up to you. You've got all the information here. If you want to know more, we've got more information on syringomaremoval.com. And thank you very much for watching.